Hello, I'm Eli. I'm from Belgium. I study nursing in Ghent. Welcome to my presentation about good practice in my neighborhood. The good practice I have chosen is community health centers, specifically CHC De Punt in Ghent Brugge. Community health centers have existed in Belgium since 1976, but it's only these last couple of years that this way to organize primary healthcare has vastly expanded. The goal is to offer high quality for local residents, high-quality, accessible, and multidisciplinary healthcare. In addition, there is a lot of attention to health promotion in neighborhoods and focus on disease prevention. By having multidisciplinary teams, CHC close the gap between traditional healthcare and social healthcare. They actively work on reducing health inequities by working with local actors and focus on all social health determinants. The community center in Ghent partnered with the city of Ghent by being on board on different city forums to think about health policies in a broad sense and to set up various projects related to health. They operate transparently by publishing annual reports about the evolution of their patients and provided care, as well as extra measures. They've also published the extra measure they took this year. It can be about extra discipline that they and services they can now offer or project they're launching or successfully established. So we can see the results of their social inclusion measures by the patient population. We have their demographics and numbers by origin and age, and also by percentage of people who have increased reimbursements. They lower their financial barriers because the patients registered in the health center don't have to pay anything for a consultation during normal opening hours. Mutuality, Belgian health insurance, pay the community health center directly for each registered patient. Having some sort of health insurance is mandatory in Belgium. For people who don't have a mutuality, they are still welcome to care and find solutions together. Patient population of CHCs in Ghent show that about 40% of their patients have a special statute which allows them to get increased reimbursement, whereas 20% of the whole population of Ghent has this statute. We can also compare this to the whole Flemish population where 15% of the people have this statute. A comparative study in the US showed a difference in patient population between community health centers and office-based practices. The results were that private practices had payments done by private insurances for almost 60% of their patients, while in community health centers, only about 15% of their patients had private insurance. They also talked about that CHCs were much more likely to accept patients through charity and see no charge patients. Like about 80%, they took on about 80% of the cases, while private by office-based practices only took in about 40% of the cases. When we look at minorities, CHC De Punt attracts people of different origins, with 30.5% of their patients not being of Belgian origin, which is in line with the immigration numbers in Ghent and Belgium. While in the US, the share of patients of non-Hispanic white people was significantly lower in THC in comparison to office-based practices. More than 60% of the patients in community health centers were of Black, Hispanic, or other origin compared to under 30% in office-based practices. In these centers, patients can go for various help to various health providers, like normal general practices, but other care providers such as nursing, physiotherapists, social work, etc. CHC De Punt recently changed to a new building to offer more space for patients and to expand their health and welfare care. In CHC, health and social conditions are combined to more integrated care. Like in 2021, De Punt was able to introduce two new primary care psychology to their center. Multidisciplinary teams can combine traditional healthcare and social care, resulting in more integrated care. that lowers barriers to reach out to other disciplines beyond general practitioners, which is especially valuable for people with chronic condition and make case management easier, which also increases quality of care. These teams are able to do active outreach to vulnerable groups and can offer more health education. They're able to reach the community better for health promotion and disease prevention. By working with local partners and participation, they're able to assess local health needs and so reach the community better for more effective health promotion. I think these centers are a sustainable way to provide healthcare um, by having a multidisciplinary team. The patient's care can be distributed among the professions fit best for their problem. In office-based general practices are heavily overloaded with work, while a different discipline could possibly answer better to the patient's needs. I think that organizing primary healthcare in CHCs is very useful in densely populated areas. It makes for a more manageable clinic workload. Um, Having a good outreach to vulnerable people is important to minimize inequities and to make sure universal access to healthcare. Being able to provide health education, promotion, and disease prevention in primary care is beneficial to reduce the cost of healthcare. In Ghent, we have a lot of CHCs compared to other places in Belgium, and the cost efficiency had already proven itself again by older types of community oriented primary care, like UNIS, of which we already have followed the long-term effect and have proven to be more cost efficient. So these are both factors why I think THC is promising to be sustainable. Yeah, so that's